September is wrapped in teal for Ovarian Cancer Awareness Month. There's a push here in Aurora to help women learn the signs early because their lives depend on it.
Women like Margie, a local school teacher. Producer Jenny Castor and I share her terrifying story.
One day I was having a hard time breathing.
Margie Borges knew something was wrong.
Well, one of my lungs was filled halfway with fluid. So they sent me immediately to the emergency room.
What came next was complete shock.
I found out I had ovarian cancer, stage 4, because it had already gone up to the lung.
First, the diagnosis.
Took me a while to have that sink in.
Then came the really scary part.
They gave me a 25% chance of living.
Sinking a backwards half cold.
This single mom was raising 2 children. A nightmare like this had never crossed her mind.
Perfectly fine 2 days before I couldn't breathe.
She also had a whole class of Aurora 4th graders at Dakota Valley Elementary that were counting on her. A disease she knew little about was turning her world upside down.
If it had not gone up to my lung, I would never have known I had cancer.
Surgeries and what would be life-saving cancer treatments followed.
Started chemotherapy, and I did that once a week for 18 weeks.
Margie was craving more information and support. That's when a hospital social worker introduced her to the Colorado Ovarian Cancer Alliance, or COCA.
We're wanting to support women who have already been diagnosed with ovarian cancer, but because only about half the women that are diagnosed with ovarian cancer will survive more than 5 years, and that's partly because they're diagnosed so late, because the symptoms are kind of quiet. We want to make sure that we educate and raise awareness and make women pay attention.
COCA's executive director, Katie Reinisch, is very direct when it comes to talking about ovarian cancer and the lack of public awareness.
Ovarian cancer is the #1 gynecologic cancer that kills women in our country. We've dramatically increased survivability for prostate cancer, for breast cancer, for so many things. We haven't had that same kind of forward progress in ovarian cancer, and that motivates me, makes me mad.
Founded in 2005, the Colorado nonprofit is focused on support of all kinds.
And I want to see more women survive.
COCA strives to give women the tools to beat this cancer, from learning to spot the warning signs early to giving a financial boost if needed.
I didn't work the whole time. It was just too much.
Fighting cancer was taking all of Margie's energy. Going to the classroom every day was no longer an option, and the bills started to pile up.
All of a sudden I get a call from Janine at COCA, and she helped me with 3 months worth of pain, like my utility bills.
COCA Cares is a fund designed specifically to help.
It's daily basic necessities of life, up to $500 a month. We pay directly.
It's about sharing information, easing financial burdens, and most of all, bringing hope.
It took a huge weight off of my shoulders. That's funny.
Well, look.
It just feels good to be living a normal life again.
She is a trooper. Margie is in remission and back at school full-time. She's made it her mission to give back by raising awareness.
Oh, that's good. The fact that Margie didn't have any early warnings is not uncommon. Dr. Saketh Gutanapalli is with the CU School of Medicine in Aurora. Welcome. Thanks so much for joining us today.
Thank you for having me.
Let's first talk about some of these vague symptoms. What are they? What should people be looking for?
So ovarian cancer, unfortunately, is one of those diseases for which the symptoms are just not very specific. We say that it's a cancer that whispers, so listen very carefully. So some of the warning signs that we tell our patients to look for are very nonspecific, but are things you should definitely discuss with your doctor. Bloating, feeling full early after a meal, feeling very vague abdominal pain that you can't quite explain, or urinary symptoms are really things that we ask our patients to look for, and those aren't very specific to ovarian cancer, but added up together may speak of that whispering that we talk about that we have with this disease.
Right, good to have that in the back of your mind.
Sure.
Can you test for ovarian cancer?
So unfortunately with ovarian cancer, we just don't have a good screening test as yet. For cervical cancer we do, for uterine cancer we do, but for ovarian cancer we just haven't developed a very good screening test for this disease. So the best thing that patients can do if they are having these type of symptoms is to talk with their doctor or talk with their healthcare provider. They might order an ultrasound, they may order the CA-125 tests, but unfortunately, none of those are specific to ovarian cancer. So the best thing that patients can do is really talk to their physician.
And are there any known risks for ovarian cancer?
Sure. So one of the biggest risk factors for ovarian cancer is a strong family history. So if you have a mother or a sister or other family members who have been diagnosed with ovarian cancer, it is very, very important for you to talk to your doctor so they can risk stratify you if you may have a genetic predisposition to cancer. Other things that are big risk factors is having an unhealthy lifestyle, unopposed estrogen, or being overweight are other things that can be a big risk factor for ovarian cancer.
Good to get it out there, and we want to thank you for being with us here today to help spread the word. We
Thank
hope
you
it
for
helps.
having me.
Thank you. And if you'd like more information about ovarian cancer, including upcoming events to help fight it, visit the website for the Colorado Ovarian Cancer Alliance at colo-ovariancancer.org.